Have you ever had one of those nights when your child just won't stop crying? Maybe they're pulling at one ear, they don't want to sleep, they're fussier than usual, and suddenly you're wondering, is this an ear infection? Does my child need antibiotics? Should I go to the ER? As a consultant pediatrician, these are some of the most common questions parents ask me in the clinic. So in this video, I'll answer everything you need to know, from the early symptoms and home care to the warning sign that mean your child should be seen by a doctor. Let's begin. Does ear pulling always mean an ear infection? The answer is no. Many babies pull on their ears even when they don't have an infection. Sometimes they are simply exploring their body. Sometimes they are teething. Some babies even rub their ears when they are tired or trying to comfort themselves before sleep. So ear pulling by itself does not necessarily mean an ear infection. What matters is whether it is happening together with other symptoms. Let's look at those next. There are several signs parents should watch for. The first is persistent ear pain. Babies can't tell you their ear hurts. Instead, they may cry much more than usual, especially when lying down. That's because lying flat increases pressure inside the middle ear, making the pain feel worse. The second common sign is fever. Some children develop a mild fever while others may have a higher temperature. Another clue is difficulty sleeping. Children who usually sleep well may suddenly wake up frequently because of the discomfort. You might also notice decreased appetite. Swallowing changes the pressure inside the ear, so eating or drinking may become uncomfortable. And sometimes you may see fluid or pus draining from the ear. If that happens, it usually means the pressure inside the ear has caused a small hole in the eardrum. While this often heals on its own, your child should be examined by a doctor. The good news is that not every ear infection needs immediate antibiotics. The first priority is making your child comfortable. If your child has pain or fever, you can use an age-appropriate dose of paracetamol or ibuprofen following your pediatrician's advice. A warm compress placed gently over the affected ear may also help relieve discomfort for some children. Encourage plenty of fluids because staying hydrated is important, especially if your child has a fever, and allow your child to rest. One important point: never put oil, garlic, herbal drops, or any homemade remedies into your child's ears unless advised by a healthcare professional. These can sometimes do more harm than good, especially if the eardrum has ruptured. Most ear infections are not emergencies, but there are situations where your child should be seen promptly. Seek medical care if your baby is younger than 6 months and has a fever, the ear pain is severe or lasts more than 48 hours, there is fluid or blood coming from the ear, the fever is very high or your child appears unusually sleepy or difficult to wake, there is redness or swelling behind the ear, your child develops weakness of the face and seems very unwell. These signs need prompt medical assessment. This is probably the biggest myth. Many parents believe that every ear infection needs antibiotics. That's not always true. Many ear infections, especially those caused by viruses, improve on their own with time and good pain control. For some children, your doctor may recommend a period of observation before starting antibiotics. However, antibiotics are more likely to be recommended for younger children. Severe infections affecting both ears in young children, or when symptoms are significant. The decision depends on your child's age, symptoms, examination findings, and overall health. Temporary hearing loss can happen because fluid build up behind the eardrum. Most children recover completely once the infection and fluid resolve. However, repeated ear infection or persistent fluid can sometimes affect hearing and in some children may influence speech and language development. That's why regular follow-up is important if infections keep coming back. Though we can't prevent every ear infection, there are several things that reduce the risk. Keep your child's vaccination up to date. Avoid exposure to cigarette smoke. Breastfeeding, when possible, offers some protection during infancy. Try not to feed a baby while they are lying completely flat and encourage good hand hygiene, especially during cold and flu seasons. The most important thing I want you to remember is ear infections are extremely common in childhood. The good news is that most children recover completely with appropriate care. The key is knowing when you can safely care for your child at home and when it's time to see a doctor. If this video helped answer your question, consider subscribing to Clinic Explained. My goal is simple: to help parents make informed decisions with evidence-based pediatric advice, one child at a time. Thank you for watching, and I'll see you in the next video.